The nurses have been leaders. We have two in this room, by the way, and you've met my wife, Mary Lynn, and you'll meet Melanie Dreyer here later this morning. But nurses, the American Nurses Association, the California Nurses Association, the other state nursing associations, 13 of them now, I think. These are the leaders. And we got one of those leaders here today. California Nurses Association is a co-sponsor with Patients Out of Time at this conference. They help us get the accreditations for the nurses in the state of California, and they have a representative here to come in and say her thing for her organization. I would like you to welcome, please, this morning, Nurse Bonnie Martin.
Good morning. The California Nurses Association is a professional association of more than 60,000 professional nurses practicing in California and throughout the nation. The CNA's primary goal is to assume responsible leadership in our communities, and through that leadership to protect patients and ensure health and welfare so that all persons may have the best possible nursing and healthcare protection. The CNA also seeks to promote the professional and educational advancement and welfare of the professional nurse and to foster high standards of nursing practice. Protecting a patient's right to take measures to treat a medical condition or to relieve or alleviate pain implicates one of the most historically profound functions of physicians, nurses, and other medical professions. A patient should not be forced to endure unnecessary pain or suffering in any form, regardless of the nature of the patient's condition or the goals of the medical intervention. Thus, healthcare providers must be free to try to provide relief from pain and suffering. When medical problems remain intractable, the patient and the healthcare provider must be free to explore all therapeutic options. The ability to pursue such options motivates and informs many patients' decisions to seek the care of a particular healthcare practitioner. As registered nurses, we often see the effects of lack of access to medications and other therapeutic measures that have the potential to relieve suffering, improve functional abilities, and promote a better quality of life. Unfortunately, one of these therapeutic measures is denied to us as a result of the social stigma and legal environment that is developed around the use of medical marijuana. In the current social, legal, and political climate, patients are often afraid to ask for this potentially life-improving medication because they fear the negative judgment others may attribute to their character or their intentions. Because of this climate, physicians are also reluctant to offer this option to patients who have failed to find relief from more traditional and socially accepted therapies. You are all aware, and if you saw the movie yesterday, even more aware, of incidents of patients using medical cannabis under appropriate medical supervision to treat pain or nausea, who have had the sheriff's department enter their home, place them under arrest, forcefully remove their medication from them, and leave these persons to deal with the terrible consequences, both medical and legal, of the current draconian legislation. Our government, on one hand, tells us, no, they actually virtually insist that we measure pain as the fifth vital sign, and it informs us that we must adequately address pain control. On the other hand, providers are becoming more and more fearful of prescribing any narcotic, particularly for chronic pain, for fear of the DEA investigation and potential loss of license. This is shameful, and we must work together to find a solution to this moral, legal conflict so that neither patients nor providers are criminalized when their only goal is to make someone's very life just livable. Because of the nature of registered nurses, and because we are also mandated by law in this state to be patient advocates, RNs in the California Nurses Association will continue to be leaders in advocacy for all patients to receive the care that they need. We will fight the corporations that have destroyed healthcare in this country through our clean nurses. through our California Nurses Clean Money and Fair Elections Initiative, which we hope to be able to get on the ballot this fall, and other methods. We will advocate for our patients when we believe that their physicians have made bad health care decisions. We will continue to fight our governor, who supports and accepts huge donations from organizations who seek to limit access to health care. And we will battle for legislation that promotes improved access to appropriate health care for every individual in this country, which includes a single standard of care for all persons, as well as a single-payer legislation at both the state and the federal level. We also will advocate for a single standard of enforcement, allowing appropriate access to the medication a patient needs in states where medical cannabis is currently determined to be legal. CNA supports all efforts to ensure the availability of this medication that provides a safe, effective, therapeutic, and uniform delivery method and system. We will work with other groups to ensure that all patients have access to all clinically proven and medically necessary therapies, and we will continue to fight for our patients and our communities to achieve health care for all. CNA is a sponsor of this educational conference because we believe that it is important for nurses and other healthcare providers to understand the science underlying the appropriate use of this medication, which includes understanding the risks related to cannabis use, along with measures that may be used to minimize these risks. It is our hope that the knowledge gained here, as presented by researchers and physicians from many parts of the world, will further empower nurses and others to effectively advocate for a patient's right to access a safe and legal supply of this medication. As early as 1995, the California Nurses Association developed a position statement supporting research and appropriate therapeutic use of this medication, and has consistently taken a leadership position in this important patient advocacy effort. We applaud People Out of Time for their continued work in providing us the most up-to-date scientific knowledge that nurses and other healthcare providers will need to continue our work of advocating for safe, effective therapeutic response to one of our most fundamental rights. Avoiding intolerable pain and suffering, as well as the indignity of losing the capacity to function, is a fundamental liberty that we must do all that we can to preserve for those of us who can fight this battle and for those of us who no longer can. I've been a nurse for over 30 years and a nurse practitioner for the last 8. Over these years, I have cared for too many patients whose pain and suffering could not be relieved by current medical therapy. I have seen too many people live and too many people die in agony. As a nurse practitioner, I provide primary care to a geriatric population, nearly all of whom suffer from one or more painful or disabling chronic conditions. Many, if not most, of the medications I would prescribe for younger persons are not safe to use in the elderly. Options are few and have recently become even less as a result of the advent of Medicare Part D, which limits our choices even more. If there is a safe, effective, and therapeutic medication, as science is showing marijuana to be, then we only have one option. We must stop playing with people's lives. We must stop playing with people's dignity. So the California Nurses Association applauds the researchers and the physicians for the work that they are doing. We thank you who use, grow, and sell this medication for medical reasons for the risks that you take every day and that you're willing to continue to take for patients everywhere. So thank you for allowing us to be a small part of your struggle, and together I believe we will prevail. Thank you.